Welcome. Today we're diving into the world of adrenergic drugs, essential medications that impact the sympathetic nervous system. These drugs play a crucial role in treating conditions like asthma, cardiac issues, and even nasal congestion. But with so many names and uses, remembering them can be tough. That's why we use clever mnemonics to make learning both effective and fun. By the end of this video, you'll have a solid grasp of the main adrenergic drug categories and their key examples, all thanks to memorable tricks. Let's get started and make pharmacology a breeze. Let's begin with anorexiants, drugs that suppress appetite. The mnemonic here is FADS. Each letter stands for a drug: F for fenfluramine, A for amphetamine, D for dextrofenfluramine, and S for sibutramine. These medications are sometimes used in weight management, but it's important to remember their potential side effects and limited indications. Using the FADS mnemonic, you can quickly recall the main anorexiant. This simple trick helps you organize information efficiently, making it easier to retrieve during exams or clinical practice. Next up are bronchodilators, which help open up the airways in conditions like asthma. The mnemonic is BF is thias. Each letter represents a drug: B for benbuterol, F for formoterol, I for isoprenaline, S for salmeterol, T for terbutaline, and S for salbutamol. These drugs are vital in respiratory medicine, providing relief from bronchospasm and improving breathing. Remembering BF is thias ensures you never miss a key bronchodilator during your studies or in clinical scenarios. Moving on to central nervous system stimulants, the mnemonic CUDMA helps you remember the main drugs: C for amphetamine, A for dextroamphetamine, D for methamphetamine, and M for methylphenidate. These medications are often used to treat attention deficit disorders and narcolepsy. By associating these drugs with the word CUDMA, you can quickly recall their names and uses. This approach streamlines your study process and boosts your confidence in pharmacology. Cardiac stimulants are essential in emergency medicine and critical care. The mnemonic CADI stands for adrenaline, salbutamol, and isoprenaline. These drugs are used to increase heart rate and improve cardiac output, especially in cases of cardiac arrest or heart failure. Remembering CADI ensures you can quickly identify the main cardiac stimulants and their clinical applications, which is crucial for both exams and real-life medical situations. Pressor agents are drugs that raise blood pressure, often used in shock or severe hypotension. The mnemonic PMNEDPME helps you remember methotrexate, noradrenaline, ephedrine, dopamine, phenylephrine, and mefenamine. These agents are vital in critical care settings. By using this mnemonic, you can easily recall the main pressor drugs and their order, ensuring you're prepared for both theoretical and practical challenges. Nasal decongestants are commonly used to relieve nasal stuffiness. The mnemonic OXPN2 stands for oxymetazoline, xylometazoline, phenylephrine, and pseudoephedrine. These drugs constrict blood vessels in the nasal passages, reducing swelling and congestion. Remembering OXPN2 makes it easy to list the main nasal decongestants, which is especially helpful in both exams and clinical practice. Uterine relaxants are used to prevent premature labor by relaxing the uterine muscles. The mnemonic SATI-RI helps you remember salbutamol, terbutaline, and ridodrine. These drugs are important in obstetric care, providing a way to delay labor when necessary. Using SATI-RI as your guide, you can quickly recall the main uterine relaxants and their clinical significance. Let's take a moment to visually recap the mnemonics we've covered so far. Each mnemonic acts as a mental shortcut, helping you organize and retrieve drug names quickly. Whether it's FADS for anorexiants or CADI for cardiac stimulants, these memory aids are designed to simplify complex information. Visualizing these mnemonics can further reinforce your memory, making recall even more effortless during exams or clinical practice. Mnemonics are powerful tools in medical education. They help break down complex lists into manageable chunks, making it easier to remember and apply information. For adrenergic drugs, mnemonics not only save time but also reduce stress during revision. By associating drug names with catchy phrases or acronyms, you create strong mental links that last. This technique is especially useful when you need to recall information quickly in high-pressure situations. While the mnemonics shared here are helpful, you can also create your own. Start by identifying the first letters of each drug you need to remember, then form a word or phrase that's meaningful to you. The more personal or funny the mnemonic, the better you'll remember it. Practice using your mnemonics regularly, and soon, recalling drug names will become second nature. Adrenergic drugs have a wide range of uses, from treating asthma and nasal congestion to managing cardiac emergencies and preventing premature labor. Understanding their indications helps you appreciate why it's important to remember them accurately. These medications are often life-saving, so having their names and uses at your fingertips is essential for any healthcare professional. While adrenergic drugs are highly effective, they can also cause side effects such as increased heart rate, anxiety, insomnia, and hypertension. It's important to balance their benefits with potential risks, especially in vulnerable patients. Always consider the clinical context and monitor for adverse reactions when using these medications. Let's quickly review all the mnemonics covered. FADS for anorexiants, BF is thias for bronchodilators, CADMU-M for CNS stimulants, CADI for cardiac stimulants, PMNEDPME for pressor agents, OXPN2 for nasal decongestants, and SATI-RI for uterine relaxants. Repeating these mnemonics regularly will help cement them in your memory, making pharmacology much more manageable. Congratulations on making it through this mnemonic-packed journey. Remember, consistent practice is key to mastering adrenergic drugs. Use these mnemonics as a foundation and don't hesitate to create your own for other drug classes. With these memory aids, you'll approach exams and clinical practice with greater confidence and clarity. Keep learning, keep practicing, and pharmacology will soon become second nature.